And now,
right now, we'll be talking about our national research survey study. I will ask Gabriela Maria Baltrushite from NGO Mental Health Perspectives to make a presentation about the main findings of the national research study. And you're most welcome to come up with questions. But of course, microphone it will be needed because, as I said, this is a hybrid event and there is simultaneous interpretation going on. And those who are just are connected to us in a remote mode, please write your questions into the chat. Welcome. Thank you, Karila, and I would like to thank everyone. So together with my colleagues, Ugne, Katrina, Karila, we just from this NGO Mental Health Perspectives, we conducted a national research study in Lithuania, and we'll be showing the slides and in both languages. And this information I'm going to share with you is just a minor part of the whole study, national study. You can find all the information just online. I will give you the link. And it's called the rights of people with mental health and psychosocial and intellectual disability in criminal justice. And we are talking here about the justice for all, enhancing the rights of defendants with intellect and psychosocial disabilities. Why defendants? Just because we use the word defendants, because in English, actually, defendants in the context of the study is a term used to refer to persons who are involved in criminal proceedings from this perspective, person serving a sentence. Defendants actually in English covers a broader context than, for example, the accused under the Code of Criminal Procedure. The translation has been chosen on the basis of the recommendations of experts in the field and in order to ensure consistency with the terminology used by partners in foreign countries. Right. Now, two actually studies were conducted as part of the projects funded by the European Union in several EU member states. And the main objectives of the studies were as follows. To deepen the knowledge of the experiences and areas for improvement of participation in criminal proceedings, the challenges and obstacles faced by defendants with intellectual and or psychosocial disabilities and mental health problems during the proceedings. The second objective and goal was to study the practical implementation of the European arrest warrant, and in cases involving persons with intellectual and also psychosocial disabilities and mental health problems. Now, the study consisted of several parts. The desk review was examined. We tried to analyze the legal framework and case law, and from June 2022 up to March 2023, 22 semi-structured interviews were conducted, and the participants came from all over Lithuania, Vilnius, Kaunas, Panevėžys, Rokiškis, and Visaginas. And we also included 9 interviews with defendants with intellectual or psychosocial disability, and 13 interviews with professionals, judges, prosecutors, lawyers, pretrial investigators, psychologists, social workers, and we really did our best to make sure that we cover as many professionals as possible. Now, what are the main findings? Well, there was a difference, let's say, in the answers. I'm talking about the defendants with disability and professionals. The experiences of defendants with disabilities revealed a lack of accessible and comprehensible information, or in certain cases, the respondents said that they are not provided the required information. Whereas, on the other hand, professionals claimed that all relevant information can be made available and everything can be sorted out if and when needed. So there were also certain questions, the answers to which actually coincided. There was a consensus on the quality of the services provided by the state guaranteed legal aid service, which is a state budgetary institution tasked with the examination of applications of individuals in decision making. And there is a in practice, there is a noticeable difference between the quality of work of private and state guaranteed lawyers. Also, it was said in the answers that there is a shortage of psychiatrists, and the professional said, yes, the psychologists, forensic experts in Lithuania who could help during the pretrial investigation. Actually, there is no legal regulation or guidelines on the role of these professionals during investigation. This makes investigators reluctant to ask for help when dealing with defendants with disability, because meaning it's not it's questionable how the involvement of other professionals will impact the sequence of the investigation. So let's say the lawyers or defense counsel find it difficult to find qualified professionals who could come up with their opinion. I'm talking about the second here part. Now, well, when we talk about our context, Lithuanian context, it became apparent that there are certain EU directives which have not been transposed into our national context. And also, we don't have legal definitions or requirements regarding the regarding the criminal proceedings, and there's no legal definition or requirements for due process in the Lithuanian criminal justice system, and the concept of vulnerability or procedural accommodations is not defined in our legislation. Sometimes we see outdated terms which are being used, they have not been renewed, and therefore there's confusion and miscommunication between the experts talking about the same matters. Furthermore, so statistics on disability are not systematically collected. The general trend is that people with disabilities often remain invisible in the justice system, and there is a lack of cooperation, especially in terms of collecting and sharing statistics and related processes, especially between the justice system and health system bodies. So official national statistics reflect a small number of such cases, which does not correspond to reality. Consequently, this often leads to difficulties in identifying the need for tailor-made support measures or procedural adjustments and procedural accommodations. There are inaccuracies in the use of terms and marked differences between English and Lithuanian. Inaccurate, outdated, pejorative, unethical terms are still used in translations of international treaties into Lithuanian and national legislation, and this creates considerable confusion and inaccuracies in the legal system for professionals working with official legislation, and a regular misunderstanding between experts. Also, let's say we're talking about letter of rights. It's also written not in a simple, understandable language. And this often influences the attitudes and sometimes unjustified practices of police officers. But this shows that trainings are needed for police officers, pre-trial investigators, and it's important. You saw the leaflets. Actually, they were developed by our NGO, Mental Health Perspectives, and in a very simplified language, easy to read format, we understand what the rights of defendants are. So this letter of rights, as I said, should be actually available to those in need. Now, what could be done to improve the situation? So we have come up with the recommendations. First and foremost, just in order to replace the outdated pejorative term mental deficiencies in the Code of Criminal Procedure with provisions on the adaptation of procedural accommodations for vulnerable persons and the right to request a review of the decision or the lifting of the measures in the case of persons who are subject to compulsory and medical measures. Also, so that was certain just adjustments to be made in our penal procedure code. Furthermore, we recommend to strengthen cooperation between the various criminal justice institutions in order to create a more coherent, effective system of adapting procedural accommodations for vulnerable defendants. And we also recommend to expand the definition and role of a trusted assistant in the relevant regulations to ensure better support mechanism for vulnerable persons. We also recommend to update the letter of rights to make the information comprehensible and easy to understand. Furthermore, we recommend to establish a comprehensive procedure for the identification, assessment, and individual support of vulnerable persons who are suspected, arrested, and charged or convicted of a crime. Also, regular quality training for criminal justice professionals should be organized. Data should be systematically collected on persons with disabilities involved in the criminal justice system. And one more recommendation is to improve the services provided by the state guaranteed legal aid service to ensure that the most vulnerable receive quality legal aid. And I'm showing here the code. You should scan it, and then you will find our full the text of our national study, and also the other projects conducted by our NGO and about our events. Thank you very much for your attention.
Please take microphone so we could ensure good quality interpretation to all participants of the event. How did you communicate with people with intellectual psychosocial disabilities? Did you have any facilitators, or you attempted to do it by yourself? Thank you for the question. It's a very good question indeed. Well, we did all good. There were no facilitators. In this case, perhaps there was no need for them because we were ready. We had information, questions. We had information, questions with easy, understandable language, and we saw that it really helped to communicate what we want to say and again get answers. Thank you for your interest, Dovile. Thank you. My question is also of similar type about executed interviews with the defendants. Could you please share what was their experience? Is it very old? Experiences they had in the past, they discussed more broadly, or more fresh, more recent, ongoing experiences we have discussed, because there is difference here. Yes, the difference is tremendous indeed, because system is changing, and there were both. I would like to call you to read full report of the research. We try to find people who either currently participated in a process or during last 5 years. I can add because I conducted this research that there was a focus, the gap or time period of 5 years. And another project, I talked to a person who was in the system 15 or 20 years ago, and experiences are extremely different because the older the experience, it has a heritage of all times. We spoke to people who have forced treatment measures in Rokiškis. It was interviewing them was a unique experience. Okay, I'd like to expand on a thought. You mentioned that investigators are unwilling to include specialists into the process. If I understood correctly, we are talking about the pretrial investigation. Maybe there are some examples of bad practice, and what choice had to be there? Can investigator be flexible whom to include or not to include, because we're talking about vulnerable group of a society? What really truly excited us during the investigation, that this flexibility in the process is present. It is possible to summon a family member as reliable or trustee in some cases, but what we heard also that when including psychologists, if help would be needed when conducting interviews or questionings, sometimes it's not clear to which specialist should be addressed, because there is no single database where their data contacts could be found. It's not even clear what kind of help should be sought after, because this disability is not always identified at the very first stage. It only later it turns out. So from this side, help, but it's not always clear what help is needed and where to turn to get it. But speaking about participation of other person during the questioning, during interviews, how would it affect the testimony? Right now, it's not defined comprehensively. I don't want to say that there's unwillingness, but there's actually uncertainty that if one more person will participate, what will it go? How testimony will be evaluated in the criminal process proceeding. Thank you very much, Gabriela Maria, for your questions. The abundance of them indicates that topic is relevant indeed, and there are things to study more deeper. And we would like to invite you to read this report, this research. It's not just a presentation. We also plan to submit practical guides, also to conduct training. So we would like to invite you to cooperate in various contexts with us. I want to thank Maria Gabriela. We don't have any questions from remote? We have, but I think this question was partly answered. Oh, it's a supplement commentary. They are asking about the help when it was spoken about inclusion of family member, about quality and knowledge of the person who was included, how it affects the criminal proceeding. Additional question was whether lawyers should get special training for that. I think this is one of our recommendations provided in the research report. Sorry, the sound is indistinguishable from the audience. This is not within the limits of competence of this research. Those recommendations, guidelines, they can be developed further, and if systemic change would occur in this place, it would be really tremendous change. Thanks, Gabriela Maria, and to you for such active participation